So, I want to talk about a new idea to help people with blood pumping problems, blood flow issues, and people with high blood pressure or high viscous blood, which is more likely to clot and cause problems. That isn't the traditional ways of using blood thinners or other things like that, and isn't about surgery to put a mechanical heart in or other mechanical pump or stuff like that, because those are highly, because all these drugs have all these side effects. A lot of the drugs work by decreasing the amount of stuff in your blood, but they also pump out a lot of other things from blood, which might cause more kidney and damage to your bladder, but also might mess up your amount of certain electrolytes and more in your blood, besides increasing chance of bleeding significantly. Well, my method will not do that. Also, any surgery is inherently very risky if you cut up anything. So what is a less bad alternative, or a less extreme one? Maybe not bad, but less extreme one. What if you had a device that instead you put it and it wraps around a blood vessel or artery, and it helps pump the blood and lower the viscosity, at least locally, maybe not throughout the system, but through the big chambers, and without ever having to actually pierce the vessel or cut the vessel. And you could even make this a very, very small device and place a lot of little ones here and there through small holes or incisions. And you could even make just a simple fabric that you tie up at the very ends together and stitch it together, so you can put it through a very small incision, all to minimize the need for expensive surgery where stuff can go wrong. So how would it work? Well, imagine you have a fabric with indentations like this, where it goes out and there's a slope back in, and out and a slope back in, and like a zigzag at the surface or teeth. And when it contracts a little bit, not hard, and causes a pressure wave, similar to a sound wave or an acoustic wave or a slinky when you push it, that pushes blood forward, and then it contracts and back and forth. It's just basically vibrating. The whole thing is basically just vibrating. The idea would be, with this cloth that's vibrating, is that when it presses it together, because it's around the artery, it causes the pressure wave to focus in the middle of the artery. It's all going in the same direction, and that pushes the blood forward. Then also when it's contracting and making the pressure wave out, it sucks the blood mostly in the middle, because again, it's all those forces and vectors are most concentrated in the middle of the vessel, which also decreases clotting because it's pushing everything away from the middle of the vessel. Now then you might say like, oh, why doesn't it suck it back or push it back in the opposite direction? Well, first of all, there's a little forward momentum just from it pushing in that direction. And there's also forward momentum from the heart beating, which helps prevent it and more redirects the energy in that direction. It's hard for the energy to go backwards and forward with the blood flow. But another thing it does is that when it's contracting, or the pressure wave, if the pressure wave is going backwards, it's spreading out in the opposite direction. Instead of focusing, it's defocusing. And you can see that with some of the diagrams I did here, like, going outwards, it's defocusing and spreading out here, and like here, which means that it actually has less force, less momentum, and just more or less slows to a stop. This is because also you can think about this as the radius is contracting and focusing as it goes to a small point. When it's going up, it's getting a bigger and bigger circle, and that's making it less and less energetic and favorable pulling it. So you have all those effects going on that all focus it along a direction. The other thing that it does to really help out is by focusing, is that blood is a non-Newtonian fluid, and I will link to that. And what this means is that most fluids, when you squeeze them more, they linearly become harder and harder, more viscous. And viscous is how hard it is to move through a tube or something. A very viscous substance is honey. It's really hard to squeeze out. very non-viscous substances like some oils that just drip out easily. So then most of the time something gets more viscous proportional to how much you squeeze on it about. Some materials are non-Newtonian, meaning that they either become less viscous a lot faster, a lot less fast, or that they have other strength properties such as the viscosity depends on the viscosity a little while ago before, the pressure a little while, where they interact with sound waves in certain ways to make them less or more viscous in weird ways, that past effects actually do matter. And that can just be because of how chemicals and stuff organize within the fluid. But one of these things that is actually blood is non-Newtonian. And when you put in these sound waves, it'll become less viscous. And that means the blood will flow more easily, which will help people with blood pressure problems and more just pump blood and will prevent blood clotting. Also, these sound waves can tear apart little blood clots or prevent them in the first place, which will lower chances that people get heart attacks. Well, and I propose to do all this just, again, with a piezoelectric thing, because it can be made into a fabric and make almost any shape or design. And it can be low-powered and doesn't emit that much heat. Well, thank you very much for listening. Please like and subscribe. It really helps the channel out. Thank you very much. Goodbye.